AAC COVID-19 Safety Protocols. With passion and vigilance, American Addiction Centers remains open and committed to serving the millions of individuals struggling with addiction, while enforcing safety and prevention as a top priority in regards to COVID-19. To keep our patients safe, American Addiction Centers has implemented strict protocols at all our facilities across the nation. These protocols include rigorous screening prior to entry, testing of all patients and staff, admissions testing, mask-wearing mandates, full facility sanitation and regular fogging, extensive PPE use on site, social distancing, and exposure and isolation protocols.
One of the things that's happened as part of the COVID-19 pandemic is people with substance use disorders and addiction have really suffered. A lot of facilities have become very restrictive, not allowing people to come in and seek treatment and services, and as a result, we're at an all-time high of people with addiction and substance use disorders suffering more now than they have, probably in the last several years. We've actually seen major setbacks in the opioid epidemic, increases in overdoses, increases in other healthcare problems related to addiction and substance use. So our goal is to make sure people can feel safe coming to treatment, feel safe while they're at treatment, and do everything we can possibly do with medicine and science to promote and maintain a safe environment while people are under our care.
We have implemented the best-in-class COVID protocols based on extensive research and are constantly improving our processes based on our experience with thousands of patients. And when it comes to testing, American Addiction Centers has its own laboratory, Addiction Labs of America. And Addiction Labs of America is the highest accredited COVID testing laboratory, providing very rapid test results with greater than 99% accuracy. And the lab has performed approximately 50,000 COVID tests on individuals, including every one of our employees and patients. Our proven track record as a leading experienced laboratory provides another layer of confidence for our patients and staff who truly deserve the utmost quality of care. So in addition to the other mandatory protocols such as masking, social distancing, extensive use of personal protective equipment, employee COVID-19 vaccinations, continuous sanitization of the facilities, and our isolation and exposure control protocols, our facilities truly provide a safe environment for anyone seeking treatment. And in fact, I believe this so strongly that I've personally referred family members and friends to treatment during COVID.
Every facility has a healthcare protection committee. This is an identified team of staff members, both medical, clinical, administrative, and from our leadership roles who are all participating in developing these protocols, modifying them weekly to daily. As new changes come through with the CDC, we have meetings about this weekly. We have calls with the corporate office weekly about this. And so we do a real team effort at the facility level with all those involved to implement these protocols, make sure they're followed every day, and to make sure that we're doing best practices and safest practices for COVID-19.
As information on the coronavirus continues to evolve, we're examining our procedures closely and updating our procedures and policies as necessary.
No way to really put a real percentage on this, but I feel like, over the past 10 or 11 months, we've increased our infection control, sanitary processes, environmental controls by probably 30 to 40% on a daily, recurring twice-a-day basis just to prevent spread and illness and concern. Everything down to every environment, every surface, every transportation vehicle. So to me, that's one of the big things that's not getting communicated out there, is all the extra things that people in healthcare and American Addiction Centers is doing at each facility to provide that safe environment.